Salvador, you've saved me. Thank you.
Hello, good afternoon. How are you?
Yeah, very well.
Good
Thank
evening.
you.
Sorry.
Yes, dark where I am.
Perfect. Thank you for inviting us today. I think I will also share maybe my screen to show a couple of slides that we have prepared.
Great.
And then maybe I can introduce also better myself.
Brilliant. Thank you, Salvador. You're going to tell us a little bit about the work that you're doing, and you're looking for some people to join you in your mission.
Yes, that's always the biggest challenge, right?
Yeah, absolutely.
Perfect. So first of all, let me introduce myself. My name is Salvador Severic. I'm founder of Salvus Health, and Salvus Health is what we call a preventive healthcare platform that we have built over the last year and a half, almost 2 years. So let me maybe quickly introduce the team. Well, first of all, I think we always like to start by mentioning what is our mission. We would like to really help people to take control of their health and have an impact in people's lives to make this much easier, let's say, and also especially to anticipate problems. Nowadays, still most of the healthcare is focused on the reactive, or let's say afterwards, once you have been already diagnosed or you have been found sick. What we want to do is help to support more like the preventive side of this industry. Over the last year, we built not just, let's say, a product, but also a team. Now we're like 5-6 people that are fully focused on this project. And we have different, let's say, profiles that are complementing these skills that we can have in the team. From, let's say, people that come from the industry, from in this case, consulting field in the pharmaceutical area, to engineers, software developers that also have been working in projects that are related to the clinical trials phase. In my case, or my co-founder Philip, we had the opportunity to work together in my previous company, in this case in Startit. It's a startup from Spain that we could grow from 3 people to over 100 in the last, let's say, 7 years. So we have some experience, but we are now surrounding ourselves with the experts that come from the industry so we can have a bigger impact and make sure that with something that is very important in this industry, that you are doing the right things. As also Celia was mentioning, regulation is very important. Also the opinion of the different stakeholders involved, from the doctor side, the government, the pharmaceuticals. So that's something we want to be sure. And that's why we have surrounded ourselves not only from, let's say, young and passionate talent, but also from some experts that come from different, let's say, areas from this industry, like from the pharmacy side, from the specialties like cardiologists, and also, let's say, people that are in the regulatory side from the government. But maybe let's explain you a bit better what is the product, what are we building? So Salvus Health, or the first product we are launching to the market, Salvus Care, it's a platform that allows, in this case, consumers to measure and get more information about their vital parameters at the pharmacy. So in this kind of point of care setup, if a person comes into a pharmacy that has been enabled with the Salvus Health solution, the person will be able to measure some parameters like the blood pressure, the oxygen saturation, the BMI, some weight. And based on these measurements, he will get some insights. And afterwards, will be also able to follow up and, let's say, monitor this over the course of the years. In that sense, the next step, what we are doing also is trying to integrate or bring this information back to other people or stakeholders in the ecosystem. So this can be used then for instance, the doctors or the practitioners that can, let's say, also be monitoring the patients in a more efficient way. So we are adding additional data points and insights, both from the patients, but also from the rest of the ecosystem. I think my video is not working. So I think here what was just finishing, let's say, with the idea is to enable the patients to anticipate, to discover if they are, let's say, in the risk of developing, for instance, a chronic condition. And we do this with, let's say, providing more accessible measurements, in this case, at the setup of the pharmacy. And this is not theory, but it's live. So it's really a product that has been launched. We have already, let's say, above around 50 customers in Belgium in this case. And they are very happy, or they are convinced that this is the way to go, because first of all, it enables the pharmacy to provide a new, let's say, service, a new way to engage with consumers. It allows them to do this in a more time efficient way, because let's say there is an important part of the flow that has been fully automated. And finally, of course, it returns into a kind of concrete business outcome, bringing more traffic to the pharmacy and, let's say, having more loyal customers. And as I was saying, it's not theory, it's practice. This is a bit the setup, how it looks today, but it's continuously expanding. We're adding, integrating new medical devices and having, let's say, a more complete, robust solution. And that's where we are now, like in 50 pharmacies around, especially in the Flemish side of Belgium, but looking also forward to expand first to the rest of the country, and then second also to other European countries, because the market opportunity is huge. And that's why we are here today, because we are looking for other, let's say, people that are hungry to, let's say, have an impact, to really help to change people's life. And in this case, more concretely, what we are looking for is people that can help us more maybe from the medical side, so doctors or people that have this kind of professional background, because that's something that can help us to move from these now measurements that are, let's say, the first step, to more like the insights, and also even further in terms of the preventive health programs that we can build. Also, we are looking for maybe in this case more in an entry-level position, but also people that would like to join us in the business side for the marketing. And that's also something that, let's say, we're really eager to keep building this brand, to not just, let's say, have a nice product, but also help us to share the word, no? Expand or reach. And that's why we're here today. I'm very happy to have a conversation with you afterwards, or if not, you can always send us an email and we can then afterwards schedule a call. So thank you very much for the invitation, and I'm looking forward to talking to you.
Thank you very much, Salvador. That sounds like a fascinating project. It's lovely to see something that's up and running and actually functioning. So if anybody's interested, please join Salvador, ask him some questions about the work. Someone has asked what kind of testing facilities are currently present at pharmacies. What we might do, Salvador, if you don't mind, we might save that question, maybe if you want to answer that at the roundtable.
Sure.
The lounge itself.
Happy to do so.
Question to talk about then, because I think that's a good question. Probably some more people will want to join you at that too.
Perfect.
Great. Thank you, Salvador. Thank you very much.
Thank you. Have a nice day. Bye.
You too.